All right, folks, now let's get into more details with the types of synovial joints. We saw some general movements, we saw some specialized movements. Now let's get into the types. Now these are going to be 6 different types of synovial joints, and their categories are going to be based on their shape, which we already said the shape has to do with their range of motion. And that range of motion is all about that axis. And so different axes are going to be applied to the different types of synovial joints. Okay? So remember, an axis is an imaginary line the bone can move around. And the number of axes are going to determine the range of motion a joint allows. So for example, we see that we have our C1 and C2 vertebrae, we know our atlas and our axes, and it has one single axis around it. Okay, so that means it's only going to be uniaxial, which we saw before because it has one plane, and that's going to dictate the amount of range of motion it has. Okay, then we can see another example of a hinge joint here. Again, uniaxial, one plane of actual movement here. And that is going to be the axis probably going across here as well. Okay, whereas this axis is probably going down here. Saddle joints, which we'll see, again, we have 2 planes of axes, so these are going to be biaxial. We see multi-axial here because there's 3 different arrows. It's showing us 3 different ways of movements along a particular axis. We also see a biaxial here. And then here we don't have any axes. It's non-axial. So that means we're probably dealing with some type of gliding in a forward to backward direction or a left and right direction. So let's get into each of these. This is going to be our non-axial synovial joints. That means they have 0 axes. They're only going to be gliding at this point. Okay, so that means our bone surfaces are going to be sliding. There's no true rotation around an axis. All we can go is going to be left and right and forward and backwards. Okay, that's what that's going to be gliding. And this is a better example than what we saw before. We saw some bones of the wrist, right, before, and we said that, okay, there's a cumulative effect. If all of them are gliding in different directions, and it can all together accumulate to having more movement, right? But individually, we're talking about the 2 bones that are going to be sliding past one another or gliding past one another, then you're going to be saying that they're only going to move left and right and forward and backward. So what we see here, again, is allow that overall gliding. Also, you'll see this between vertebral joints, okay? So between the surfaces of course, our vertebrae, you will see that gliding forward and backward, of course, left and right. And remember, cumulative effect. So if this is happening between vertebrae, we put it all together and it create our spine, then that's how we have more movement altogether of the spine. We're going to talk about our first uniaxial joint, which is going to be the hinge joint here. And before, let me just go back. Before, when you're talking about gliding, you're only focused on a plane joint. That's what that means. And plane means it really just has no plane of axes. Now back to the hinge joint. A hinge joint is going to have one axis. So what we see here is a humerus and an ulna. We know that they're going to articulate with one another, and how they're going to articulate is a part of an axis, so you can even draw your imaginary axis to let you know what movement that's going to be. And think of your elbow, okay? I'm going to move my elbow. I'm going to move my forearm up and down through my elbow, and that is going to be a hinge joint. And again, it's going to be going through that particular axis. Okay, so how does this actually look? You'll see it looks like you have a cylinder and a trough, and you have the ability to have flexion and extension. So remember, flexion means bending along the sagittal plane, extension means to straighten that flexed limb, and hyperextension means to stretch beyond an anatomical position. So you can see you have your flexion as well, kind of moving it up. You have your hyperflexion as well, and then you have your extension, not hyperflexion, hyperextension, excuse me, and then you have your extension that's just going to be in a normal elbow position. Okay, folks? Again, try to figure out ways to remember these by using your own body. You know you're talking about your humerus and ulna, so we're trying to connect the upper arm to the lower arm through our elbow joint. The next joint we're going to talk about is the pivot joint. This is also uniaxial, okay? So we're going to move in one single plane. And if you like basketball and stuff, you're like, okay, I'm going to pivot and things like that. It might be easier for you to remember it, but if you don't, then let's just go off what we see here. So what do we see? We see our ulna and we see our radius. And we see that they are connected, of course, through a ligament here. And how can we notice our ulna and radius? Our ulna, of course, is going to give that U shape here. And, of course, our radius is going to be like a flat circle on the top of it. So another way of kind of looking at this is that we have our radius, and there's a ligament that's kind of wrap around the radius to connect it to that ulna. Now, again, because it's uniaxial, we want to figure out where the actual axes will be. You can just write an axis down that radius. That's going to allow us to see that movement. And the only type of movement we're going to see here is rotation. So rotating. And that makes sense, right? Because if you're thinking of your radius, which is going to be connected where your thumb is and allows for more movement in your hand and your ulna, you can go ahead and do supination, pronation, and that is going to give you rotation of those bones there, okay? Into our first biaxial joint, that means it's going to move in two planes, okay, and can combine into circumduction as well. This is going to be our condylar joint. And remember, if you think of condyles or those bone markings, that means you kind of have like that flat knuckle surface in between bones, and of course, it's going to have cartilage on it as well. So when we're thinking of our joints, we can think of here, which is going to be a picture of our knuckles. Okay? Biaxial means that it has two planes. So how we go ahead and write this? Well, first, you can see we have a plane going across both of these actual bones and connecting at that joint. And then we also have a plane that's going forward and backward. And so when we're thinking of our planes here, our X, our Y, and our Z, we can think of this as the X and Z. That's going to be forward and backward, up and down, left and right. I mean, it doesn't have to be that specific, right? But just to show you how we would actually create those axes. They also have better ideas of how you create those axes here. And what are we doing? These axes are going to help us with our range of motion when it comes to a condylar joint. So that means this condylar joint is going to have biaxial movement. And so it ups the ante. As you can see, there's more movements that's going to be combined. We have flexion and extension. Of course, we have hyperextension included in this as well. And then we have adduction and abduction. So that's also going to include circumduction as well. So flexion and extension. Flexion means bending. So you can actually bend at this along this plane. Extension means you're going to be straight in that limb. Hyperextension means you're going beyond the anatomical position. So if I'm just looking at the ability to bend my actual finger, I'm looking at my index finger here and I'm bending it. Okay, that's flexion. Straighten it, that's going to be extension. And then bending it all the way back. Sometimes when we were kids and we play those little games where it's like you would bend your fingers all the way back, you see when it just starts to hurt, whatever, right? Come up with any idea. That's what comes to my mind. And there will be that hyperextension. Now, abduction and adduction, we know that adduction means to move a limb away from the midline, and abduction means to move the limb towards the abs or the midline. You also have circumduction, means that you're creating some kind of point, and you are allowing a circular movement at the distal end of it, okay? All right, so with that same index finger, I can move it toward the midline or towards the abs, so that's going to be abduction. I can also move it to the right and move it away from the midline, which is going to be adduction. I can also go ahead and move my overall finger, my index finger, in a circle. That's going to be circumduction. Another example of biaxial, meaning movement in two planes, are going to be the saddle joint. And you can see this in your thumb. Okay, now the saddle joint is still going to have the same type of movement that we're seeing. So again, we're going to have an axis going across, an axis going this way, so that we can understand that biaxial movement. So we have adduction and abduction, flexion and extension. And again, with flexion and extension, this time because we're talking about the thumb, it's not in the same position as the index finger I was using before. So I can definitely bend my thumb. That's going to be flexion. I can go ahead and straighten it to extension. And again, I can try to bend it back for hyperextension. It doesn't go as far, right? For some people, it does. Now, with adduction and abduction, then we also know that we're going to be able to move our thumb toward the abs or towards the midline. That's going to be abduction, and away from it, which is going to be adduction. We also have the ability to have circumduction here. Okay, so similar movements when we talk about biaxial, just like we saw similar movements when we were talking about uniaxial. Now let's get into the final piece, which is going to be multi-axial. That means you're using all three axes, okay? So we know we're going to be having our axes going down here, across here, and across here. So that's three different axes. And these are going to be our good old ball and socket joints, which we've heard about a lot, for the humerus connected to the shoulder girdle, and for the femur connected to the pectoral girdle, or the hip bones, okay? And what do you want to do? You want to do the movements. You do the movements is going to help you remember these, okay? That's just the best part about the joints is that you can actually do the movements physically, and there's nothing internal that you have to focus on. That's actually the best part about the skeletal system and the joints overall. You can actually feel certain bones, and you can actually do the movements for these synovial joints. We have movement in all three planes, and we can also do rotation, which is really cool. So let's go ahead and look at this ball and socket joint, course, this is socket, and this is going to be like the head of the humerus or femur. We're focused on the shoulder here. You can also think of this for the joint as well. Now, let's think about the medial lateral axis, that imaginary axis that we have. We can have flexion or extension. So that means I can move my shoulder in a flexed position and move my arm up. I can put it back down in anatomical position, and therefore I would have extension, and I can move it behind me and have hyperextension. Okay? Next, adduction and abduction. Same thing. I can go ahead and move my arm towards my abs or to the midline, which is going to be abduction. I can move it away, which is going to be adduction. I can actually do circumduction as well because my shoulder joint can be that point of the cone, allowing my arm, my hand to move in a circle. Okay? And then, of course, I have rotation. You saw that. I can rotate. You're thinking about your forearm, helping you with rotation here. I can have supination, which my ulna and my radius are parallel to one another, and I can have pronation, where they kind of cross, and my palms are down, right? So that's kind of one thing that you can also see as well. And then as far as rotation, that's another thing to see, but then also with rotation, I can just rotate my actual arm and my shoulder joint, as I'm doing here, just rotating, rotating, rotating. Sometimes you can even come up with dances for these because you know if I'm rotating my arm and doing like some kind of pump, then what type of synovial joint movement am I using, right? First, you can classify it as unilaxial or gliding, non-axial, is it multi-axial or is it biaxial, right? Then if it is one of those particular things like multi-axial, is it going to be flexion and extension, adduction and abduction, rotation, or a combination of all? So just keep that in mind. So that kind of ends when it comes to us talking about movement of synovial joints and joints in general. The next video is going to all be about disorders of joints. So I'll see you there.